Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Hello,
Hi,
how are you?
I'm doing good. And you?
Good, good. It is so lovely to finally be talking to you.
Same here.
Yeah. Right now, are you in I don't remember where you're based right now.
I'm in Columbus, Ohio,
Oh, you're in
United States here. Yeah.
right. So
How are
it
you?
must be 8 p.m., right?
Exactly. It's 9 p.m. We now have the daylight savings.
Oh, you're right. Yes. Yes, I am in New Jersey right now. I
Oh,
live in New
nice.
Jersey and I work in New York. So pretty
Oh,
much the
cool.
tri-state area.
Oh, that's real good.
Yeah, are you excited for tonight's session?
Absolutely. I'm excited to talk with you and to go live with you. It's a
Can
passion.
you, thank you so much. Can you tell me a little bit about how you, okay, let me start by asking you my favorite question. What,
Yeah.
according to you, is health and fitness?
Health, according to World Health Organization, is a state of physical, mental, and social well-being, and not just absence of diseases or infirmity.
Mhm. Right.
This is the standard definition of health according to World Health. So, for us to claim that we are healthy or we have good health and we are fit, health and fitness, we must be physically healthy, we must be mentally healthy, and we must also be emotionally healthy. These three components make us healthy.
What do you think fitness is?
For us to be fit, if we look at the other side, for us not to be fit, that means that we are not in a good state of mind.
Right.
And when we look at fitness, usually people consider the physical body, but we're also looking at the emotional body or the internal body.
Mm-hmm.
The way we can achieve fitness or we can look into fitness is somebody who is physically able to carry out his or her daily activities without any impaired hindrance. This will boost us or enable us or enhance our physical activities, and we need to ameliorate this by improving in our exercise.
Right.
Exercise is very important, and that is why anybody who cannot physically perform exercise, the person might consult a therapist
Mhm.
who would perform something called a physiotherapy on the person or to improve the person's fitness. Another thing which improves our fitness or which classifies our fitness is our diet. The
Mhm.
common saying is that we are what we eat, or you are what you eat. So your diet has a long role to play in your fitness. So two major things, exercise and diet, plays a major role in our fitness.
So well said. Thank you so much. I really truly agree with whatever you said. Diet and exercise are such crucial part of our life, and we take it very lightly. Both these components will either skip the exercise or will do a cheat day and just not take our body seriously. How did you start your journey in health?
I started my journey in health 20 years ago, and I started this organization 15 years ago,
Well,
5 years after my journey in health. I have practiced in three major continents. I practiced in Africa, I practiced in Asia, and here in the United States of America. Africa in Nigeria, Asia in the Middle East, Saudi Arabia, Kingdom of Saudi Arabia, and here in USA here, Columbus, Ohio.
that's a huge thing. It's so difficult just to get licensed in one country, in one state. And you've managed to do it in three continents and you've been so successful. That's amazing. Hats off. Honestly, hats off.
Thanks. I was in New York about 5 years ago. where I did a master's in public health here in Garden City, New York, Long Island.
Yes.
I,
It's
I lived there.
oh really? I work very close to Long Island.
Oh, nice.
Yeah, LIC. I work very close to LIC.
Yeah. Is it close to Jamaica?
Yeah, yeah, Queens.
Queens.
Correct.
Queens. Very good. I know the place, the county.
It's it's
I
it's fun. Good.
Yeah, I was in Garden City. Garden City is a beautiful place in Long Island. Garden City. It's a beautiful place.
Yeah. Long Island, I love it. It's so Gucci just to be around in Long Island City. If not Manhattan, then Long Island City is
Manhattan. The thing about Manhattan is it's when I went to Manhattan, there was actually no place to park your car.
yes.
It's like you have to go through a train or you take a cab and just drops you immediately and leave. Lies from it.
Hmm. Yes, that's the story. That's the reason why I don't want to buy a car here. I am dying to get a car for myself, but no.
Yeah, because if you have a car in that kind of place, there's actually nowhere you could park your car all the time.
Correct.
And you'll spend more with your car than even just taking a cab or taking a train.
True. Yes.
That's just it.
Trains are pretty feasible. Trains, buses, they're very accessible. So I love it. And it's fun to be, to ride in the metro or the subway. It's
Yeah,
fun.
yeah.
Well,
I did the train multiple times in New York. It's very fun. The trains and the buses, you just have to find a time when they come and they are very affordable.
yes, definitely. Well, you should let me know when you're here and we should catch up for sure.
So for
Maybe
sure.
maybe we can plan some trip and you should just come here visit. I'll show you the city around.
Absolutely. That will be. You could let me know when you're available. I will take time to come.
Definitely. It would be really nice.
Nice. Nice.
You were mentioning about your organization, Love for Health,
Yes.
right?
Right.
How did you start it? What was your inspiration? What was the idea behind beginning this program?
Love for Health organization started 15 years ago in 2008 in Africa, and it was born out of my passion together with my colleagues' interest in saving lives, particularly those of women. I was in obstetrics and gynecology class at that moment. That's called Ops and Gyne,
Mhm.
where multiple women had complications of birth due to lack of funds or poor education about their health. So we had cases like preeclampsia. We had cases like gestational diabetes,
Yes.
maternal mortality, where women die during labor. So most of these complications are avoidable if they are well treated. So due
Yes.
to this, we founded Law for Health. I wrote a journal about healthcare in 2008, which was groundbreaking, and it was published in the university's journal. I also wrote a letter to the governor, which was published in the state. So I now found out that there's lots of work to be done, and there is a breakthrough which I could make through this organization. When I graduated, I set up the organization, started a website, and the primary role or goal of which we do it is providing care,
Right.
healthcare. We registered this organization in Nigeria, and we also registered it here in the United States of America. So it is an accredited organization, and the primary role again is virtual care. We started providing healthcare to people, and over 15 years, we've provided care to over 1 million people
Wow.
virtually.
That's amazing
Yeah,
to be even able to think that 1 million people will be affected by your work. And
yes,
while this idea just came out of something that we all observe, we all study, and it's avoidable, you took steps, you took measures to work on it. That's
absolutely.
incredible.
Yes. Also, we expanded from the female care or women's health to general health. So now we s- we initially started as caring for women. Now we address it as caring for you. So it includes men, children, and when we changed it to caring for you, the
Mhm.
turnout was more impressive. More men came, and a baffling or troubling concern men have is conditions relating to erectile dysfunction.
Right.
Also, we found out that many of them have stress related anxiety,
Hmm.
which affects their performance. Also, this is where the question you talked about fitness, we found out many of them are not physically fit.
Correct.
That is a major thing we found out.
Mhm. So, how does your organization work? Like, I know we were mentioning about online healthcare services, but how does it go about?
We have an app. Thank you for this brilliant question.
Mhm.
We have an app which is connected online,
Right.
but everybody does not have to download apps because we all have multiple apps on our phones. Once you send us a message on Instagram, as you or someone sends us on Facebook or TikTok or Twitter, the application comes to our phone and we are able to receive it. So we have the app on our phone like this, where we receive everything live and we can see, even as I'm live, it's showing on the app that, okay, yes, you're live, and I communicate with people. So
Right.
that is how we do it. It's a virtual care, it's an innovative product which I presented to a university here, and the professor was quite amazed and impressed that, because I'm doing a postgraduate studies here also in addition to practicing. So I'm doing the postgraduate studies here in US. So when I was to present my innovative product, and I talked about Love for Health as my innovative product, and I showed the professor all what I have done, the professor was amazed. That, wait a minute, have you done this before this class started? I said, I've also just, I've been doing it before, but your suggestion of innovative product even added more value to it.
Yes.
And she was really amazed.
So, what if I download the app, whatever I'm going through, if I have some symptoms, I can just hit your text, talk to you.
Yes.
How will I be connected to a physician? How does that go?
Yes, you are connected to a physician. And as I said earlier, you don't even have to personally download the app. Our app is connected to our social media. So when your app like Instagram sends a message to our Instagram box, we get the message on our app. So we have a general app that is connected to all our social media handles. So we can communicate with you. This means that once you send us a message, either through Instagram or through the app, we still get the message directly, like a text message, and a doctor would respond to you immediately, free of charge, completely free, free
If the
consultation.
if the patient needs medicines or something, if she's a woman, she's pregnant, she needs multivitamins, she needs other care, how is that provided?
That's a brilliant question. Now, we are also working towards the next step, which is going to be elaborate, where we are going to connect directly to health centers. We are working back there in Africa. So what we do is that we provide virtual care, as we said. We
Mm-hmm.
provide health advice, health tips. We go online to provide all. We have our website where we do everything. Then for now, if they physically need to see a doctor, for example, she needs an emergency attendance, we recommend them to visit a physical hospital.
Right.
But the basic thing we are doing now is providing free health care counseling, free healthcare teaching. And what you said is like what you already foresee us doing. In the future, we are looking forward to partnering with physical hospitals, it's going to be elaborate where we can provide, but this time it's going to be capital intensive.
Right.
It's
Definitely.
costly.
Because you're connecting, there's supply, there's demand. It has to have a lot of capital.
So we're going to work with HMOs, we're going to work with healthcare insurance, Medicaid, Medicare, and work with private companies and also government parastatals on how we can provide health. So the major thing we are doing is providing healthcare to the doorsteps of everybody. Let me use this opportunity to say this. Do you know, or let me just create a rhetorical question. Do you know that healthcare, when I was in Saudi Arabia, then in 2000 and between 2015 to 2017, when I practiced there as a medical doctor, do you know healthcare over there is completely free or was completely free? I don't know now if it's changed. It's free.
Wow.
As a citizen, you just go to visit the hospital there, you don't pay, you just present your ID card.
That's how it
Even,
should be.
even if you're taking, as you mentioned, delivery is free, surgery is free. I'll give you an example. There was a driver, imagine this, imagine this even happening in the Western world. This person might have,
Right.
he might survive, or even if he survives, he might be indebted a lot to the government. You know how healthcare is in the Western world. So this driver had an accident and is diabetic. For him to be diabetic, it's a high risk of amputation of the leg. It can develop diabetic foot, and his
Right.
diabetes is very high. He was on expensive insulin, not just cheap insulin, very expensive ones. The government gives him everything free of charge over there. He had a road traffic accident. He was rushed to the hospital. I thought, wow, this person, above all odds, this person might not be able to afford, but found out that the government provided free insulin for him, free treatment, free surgery. The surgery would worth close to hundreds of thousands of dollars. It was done completely free.
Yeah.
And I saw this man after a few weeks walking on his 2 feet. He had a fractured tibia, that is the leg broke in the road traffic accident, and is diabetic, a high risk. If it was somewhere else in the world, this person might have died. Not because they are not expert doctors, there are expert doctors everywhere,
Right.
but we know that if we look at Africa or we look at some parts in Asia, it might cost a lot or a fortune to get that treated, but it was done absolutely free. So this is something we are trying to bring to the world. We are trying to replicate World Health Organization standard, which says health for all. Even if people would pay, there should be provision for them to do so.
Right. That is so amazing what you just said. Health
Mhm.
should be free. Europe has such amazing healthcare system that they provide the best of health and treatment for everybody. It's amazing.
Even in Canada too. Canada
Mhm.
health is completely free. My brother is there in Canada. He's been there for close to 12 years. 100% free. So this is a good example. Europe is one, Canada is another. So health should be accessible, should be affordable,
Mhm.
and should be accessible. Yes, accessible and affordable.
Definitely.
These are two main things.
Your approach to start with patient education and patient awareness is amazing. That's the first step. If we educate the patients and people around us as to what they need, what they're going through, they already know the first step. They know what to expect, how it's going to happen, so they're not scared. It's amazing.
Yeah. Now, about patient education, we call it primary care.
Mm-hmm.
And yeah, there are multiple primary cares here in the US. Also here in Ohio, I've seen multiple primary care. The advantage of the primary care here in the US is they provide basic care at little or no cost.
Right.
So that is good. So I've been to one, there's one called Primary One. I walked into the health center And I found out that you are asked to present your ID, you are asked if you're working, they don't investigate. If you say you are not working or you can't afford it, they do it for you. Basic healthcare like HIV tests, STI screening, vaccinations, things for kids and things like that. But when it comes to surgical intervention,
Right.
hmm, it's very expensive right here in the US.
Yes. Being in the system and just being in physical therapy, I know how expensive that can be. Just my patients struggling to come see me and their insurance having to pay. I completely understand.
Yes.
That's why we try to give the best care that we can, in
Mm.
whatever insurance that they are covered with.
That is so nice. And one major thing we talk about, which works with what you're doing, is patients should also have the culture of exercising. Many
Yeah.
people live a sedentary lifestyle. So, physical fitness, as you talked about, and the question you asked initially, the first one is what is health and fitness? So, they must have a state where they are physically, mentally, and socially also fit. So,
Right.
we encourage everybody using this opportunity and this medium or media to tell people that you need to exercise regularly. Somebody who exercises regularly has a higher chances of living longer. You need to eat healthy, avoid harmful diets, avoid things that could make you obese, things that could make you develop medical conditions or even physical conditions that will not make you fit. So this is a basic concepts which we have to talk about and we need to encourage people.
Yes. We study. I remember every question that was asked in my third year or final year of my bachelor. The answer for it began with patient education.
Hmm,
I never took that seriously until I started practicing here in New York. And I realized how important it is to educate the patient and the family.
absolutely. Absolutely.
50% of my work, my job is done.
Educating them. And
Yes.
we have to keep educating. And that is what we do in Law for Health. We
Hmm.
spend 90% of the time educating, educating them, talking about health, talking about how they can take care of themselves, talking about how they can live a good life. Patient education cannot be overemphasized. We need to keep educating them completely.
Yes, patient education plays a very important role, and you are doing an amazing
Thank
job through
you.
your app. The awareness, the education by professionals
Yes.
is
Yeah.
amazing. How did you think about getting into telehealth?
Yes. One of the things which made us start this telehealth was that about 14 years ago,
Right.
it's 15 years, but we went more into telehealth health this year. But before that, we've been doing physical health campaigns where we go to
Oh
places.
wow.
So most of the time, we physically go to places. We have records of them on our website and also online where we provide physical health care to people. So COVID-19 is a game changer. That's one of the factors
Yes.
because everybody got scared. Even doctors also were concerned. How do we reach out to people
Mhm.
when there's COVID? There's no way we can do it. So
Right.
many people started virtual care. That's number one. Number two, that also it made me interested or initiated this telehealth was my studies in postgraduate. My research in postgraduate was going into virtual care, and that was the specialization I was taking in consideration to virtual health, looking at COVID. Because when COVID came, we had to do more of virtual lessons.
Right.
And our professor was encouraging us to look at virtual medicine or how, or the revolution of virtual health or telehealth in our 21st century. So, this also, in addition to what I talked about, the innovative product, which I had to make a research on and present, I then had to upgrade this organization into telehealth. And through this, we have reached millions of people on social media. Millions. For example, when we make a post on Twitter,
Right.
we see the views, millions of views. There is one again we did on Instagram here,
Mhm.
over 100,000 views of it. And I was like, okay, this is a way people are watching you, people are listening. I want to say this also, since we are talking about telehealth and we are online,
Right.
many people watch what you do, even if they don't like or comment, but they watch it. And that's
Yes.
the aim, that's the message. They are seeing it, they're viewing it, they're watching, which is a good job.
When I started Let's Talk About Health, this is my personal experience. My aim was, because I had a lot of seniors and mentors from India in my bachelor's that I admire. I admire their journey. I admire what work they have done. So I just wanted them to come online live with me and just talk. It can be personal journey, it can be technical terms, do squats, do this, do that, but just come online and just start talking about health. And I was approached by a few people asking, are you doing this for likes? Are you doing this for followers? And my response was, I honestly have no idea about likes and followers, how many likes I get, how many follows I get. My only thing was that I admired their journey. I admire health and awareness so much that I wanted to take a step. And that's how we started. Let's talk about health. It's not been more than 2 months now,
Mm.
less than 2 months actually, and I've already, I think you are the 24th guest on this show, and I love it. I love talking to such amazing people, just learn and hear about their experiences throughout their walks of life, and it's amazing. It's educating. It's inspiring.
That is so so nice. You see, I would even I would even encourage you that you can even go beyond the health specialty. Maybe in future, you could even invite celebrities, invite people of other fields, commerce, industry,
Right.
because they all also have a story to tell, and it will still boil down to health at one point or the other.
True. Yes. We'll plan something. We'll do together. Now we've started it
Absolutely, I
together.
absolutely. I am 100%, 100, and I mean this with all sincerity, 100% willing and ready to partner with you at any point. Reach out to me. We respond. One other secret we have, which is different from all other health
Mhm.
organizations, we make efforts to respond to you. You
Yes.
notice that?
Yes.
We respond to you promptly within 24
100%.
hours, unless there is a break in network or transmission, or we didn't see your message or so. But we would make effort to respond to you promptly. Unlike there are many organizations, they've gone very big, and because of that, they don't respond to upcoming. We don't do that. Even as we are, someone comes to us who has little or no followers, reaches out to us, we respond. We don't look at your status or your likes or follow. No, we want to provide healthcare and reach out and impact people as much as possible, which is good. I really like what you're doing too. I'm ready to work with you fully. Just reach out to us, draft a plan. You want us to have this interview together with other people, Love for Health, and your organization or your group or your what you're doing. We are ready to work with you at any length.
I love the physical camps though. I'm in for physical camps. We did a physical therapy camps in India and Pune, and I honestly enjoyed that. So maybe we can plan something like that.
Yes, yes, we can. We can do that. We can absolutely. We can. I worked with an Indian dentist in Saudi
Yeah.
Arabia, Dr. Shafi Pena.
Uh-huh.
Shafi Pena. I think he relocated back to, I believe, Mumbai with his family. He's doing all right. So hopefully he's going to watch this also online, and I'm reaching out to him. So yeah, it
That's
was a
lovely.
nice experience. Yeah, it was a nice experience. Very,
Yeah,
very good.
Yeah, that's what the goal matters. We have the same goal. Everyone that I'm talking to they all have the same goal to help people, to help the society with health, fitness. It can be different forms, but the goal is the same.
Absolutely, absolutely. Helping humanity is all our goal. And unfortunately, we humans are providing ways to help, but at the same time, we're also providing ways to what? To hurt ourselves,
Hmm.
like harmful things, like guns, like wars, like harmful drugs, like knives that could hurt people. Some people use it in the wrong way. So I believe a good health education, which you also mentioned, and health awareness is very, very, very important. I'll say this: what we take into our body makes us healthy. What we take into our body also makes us sick.
Right.
Many of us take harmful things either deliberately or not. For example, sugar. Sugar tastes sweet in the tongue. It could be deadly or harmful if it's taken in excess. It's good in taken in moderation. A good example again is salt. Salt, if taken in moderation, just little, it's good. But excess salt can cause high blood pressure, hypertension. Excess sugar is not also good. It could cause some debilitating effects in the body. Many people don't know. Sometimes you take in excess sweet things, pop, soda, coke, anything. Moderation is good, but when we take in excess of these sweet things or fatty meals, we could cause ourselves obesity. It could lead to diabetes. It could lead even to hypertension, lead to multiple cases. And one of the greatest complications of this long-standing hypertension, which is a leading cause of death in the world, is heart disease, ischemic
Right.
heart disease. Another one again, the second leading cause of death in the world and in America is stroke,
Yes.
which we
Yes.
call in medicine cerebrovascular accident, CVA. And there are about three kinds. It could be an hemorrhagic stroke, it could be an ischemic stroke, or it could be a transient ischemic attack.
Hmm.
So these are just some of the effects that we have from our diet and lifestyle.
Yes. That is so true. I personally, being a physical therapist, I see so many stroke cases. And it's heartbreaking when they go through recovery and what they have to go through. I have to make them exercise. And when I make them exercise, I'll make sure that they're sweating or they are really working out, doing 50, 100 counts because they need it. I can see how exhausted they are. I can see how hard they're trying. But recovery from stroke and heart problems, heart attack, it's really very difficult. So we should be more cautious and aware about what we put in our body and how we use our body to move.
Okay, that's absolutely true. And unfortunately, many people who have had a stroke have a higher chance of developing another stroke.
Yes,
Also, many people who have a stroke, either they develop paralysis, they are able to raise the right hand or the left hand,
yes,
or the right leg or left leg, or their mouth deviates to a side, either the right side or the left side. Also, somebody who suffers a stroke, or which we call cerebrovascular accident, it affects the brain. If it's the right side of the brain that is affected, the left part of the body is unable to. So it's called ipsilateral condition. It's ipsilateral. Also, many of them who suffer from stroke, unfortunately, they may not be able to recover fully. Some do, but some don't.
yes, true. Everything that you said is completely true. And we see those cases. It's so heartbreaking to see them. Right. What are your next steps or your next goal towards love for health?
My next goal is reaching out to people like you, which happened, partnering with people like you, honestly, collaborating with more people, establishing it on a bigger scale, looking for people with more similar views, and seeing how we can help humanity further. Honestly,
That's all.
so you coming into the picture, and I also watched many of your interviews. You said 20, yeah, I watch many. I watch it and I see different people, board certified. You interviewed someone with hips specialization,
Yes.
one physician, and I'm like, wow. You see, so this is something which I would also love to work with and see how we can work together to provide more care, reach out to more people. So one thing we do, which I would like it to even be on a bigger scale, is providing health care and counseling to people, reaching out to more people, as you said. And you mentioned India, Africa, America. Yes, we can see how we can do it. Even when you are going to India next, even if it's going to be a virtual communication, which I will talk with them, you will be with them, and we'll talk about, we'll look for a very interesting topic. So this is what I'm doing, like TED Talk, things like that. Like, we want to talk of depression or talk about physical therapy, as you mentioned, and look at how we can advise people. We can't overemphasize the importance of health education.
Yes. Yes. 100%. Yes. I agree with you.
Health education is very, very important.
Very important. Yes. And talking to you makes it so much more clearer that you have helped so many people along the way. It's definitely such a huge thing. And thank you on behalf of everyone. I don't know if they mentioned it or not, but I want to take this opportunity and thank you for this initiative, for this organization, doing an amazing job.
Just today, someone told me I felt depressed, and after talking with you, I feel relief. That means a whole lot.
Right.
Imagine someone reaches out to you that the person wants to commit suicide, and you are able to talk the person out of doing such a harmful act and
Mm-hmm.
providing care, support, relief,
Right.
rehabilitating the person, and making the person successful. That's gone a whole lot in that person's life.
That's saving a life.
Exactly. And that is the role of our health organization, saving lives, providing health care, counseling. We attend to multiple cases virtually. Many people ask us questions relating to health. Also, there's something which we do. We go all out of our way sometimes by providing supportive and relief materials, which is exceptional. So imagine a doctor or a medical professional treats you for free and even gives you money again to go home, and you are like, it is exceptional. It's something which we are just doing out of the way because it's also like an NGO
Yes.
providing care to people. But the limitation we have, and a question to further answer your question, is we are limited
Yeah.
because it is still private, and so we can't do all.
Right.
So our long-term goal is to do better than what we are doing, provide a larger scale of health, collaborate with people like you, work with both government and non-governmental parastatals, link with more hospitals, providing direct care and access. We're even looking forward to where we can even have emergency services.
Right.
Someone calls us that, oh, they are in depression, they are suicidal. We can go there with an ambulance, get them out, relieve them, treat them. These are long-term plans. Finally, we're also looking at going global, not just in America or not just in Africa, going to every country like India, as you mentioned,
Yeah.
Pakistan, going to New Zealand, going to many other countries, Bangladesh,
Mm-hmm.
Zimbabwe, Nigeria, Italy, providing free care. And online, we relate with people from different parts of the world, from different countries. They come to us, they ask us questions. So these are successful stories.
That's amazing. That's really inspiring. And I know
Exactly.
I can see the bigger picture. I can see a a way that, people when they ask for help, they get it physically. And we need to put in more efforts. We have to do something from our side because the world would not change if we don't take the steps or measures to change it. So,
Right.
yes.
Absolutely. It's very, very true. And it's really encouraging. when your joy comes from making people smile, when you are happy, when people are happy, and when you can bring succor and relief to people's lives, it goes a long way in
Definitely.
also. It does a lot.
Yes.
So one of our long goal again, since you asked, is to partner with big organizations like World Health Organization,
Mm-hmm.
like UNICEF, like USAID, like the United Nations.
Mm-hmm.
So we're looking forward to partnering with them, working with them. We know they have like Doctors Without Borders. They have doctors who voluntarily go to places where there are problems, where there are war, where there are famine, where there and they provide free services to people. So this is the kind of service we're also looking forward to collaborate with.
Right. Definitely. I'm really excited and happy, and I can't wait to see where this goes in future. And I know it's gonna go a long way.
Yeah. So I'll be looking forward to that. I will be looking forward
Yes.
to, and I will be looking forward to, as I said, your feedback on. You talked about multiple things. I am a to-do person. I like following up whatever I say with work and actions. I am not a person who just says things
Mm-hmm.
just for saying no. I like us to do it, and I mean it with all sincerity. I would like us to work towards working together. You talked about India. I would like us to really do it, even if I can't physically go there. If we could do it virtually, where we could talk with them, encourage them, share good stories, I would like it. If we could also reach out beyond the medical professionals, everybody has a health story.
Right.
I'll give you a good example. There's someone whom was in another field, and for 20 years they had infertility, but they had the hope, they had the courage, and after that, the person gave birth to 8 babies.
Wow.
Yeah, it broke the news. Eight
Wow.
after
Amazing.
20 years. Yeah, but definitely now in this world, we have IVF, in vitro
Yes.
fertilizations. It
Yes.
could be IVF, but the person after long. So these are kind of stories we want to share with people also. So the person might not be a medical practitioner, but the person could share his or her medical story, which will motivate others.
Definitely. I'm excited to be working together. India project
Definitely.
is on. I will take some time to think about it. I will form a few ideas and drafts, and we are working on India for sure.
Absolutely. Absolutely. We can definitely work together. We can interview people together. We could bring more people, go live with them. Like when I do live, I invite people from different parts of the world. If you watch my life, I invited one lady, Tara, American here. I invited another one from another country. So three of us were talking, and our topic was breast cancer. It is the leading cause of
Yes.
cancer mortality in women. We also talked about, and I asked the question there that, did you know men also have breast cancer? And everybody was like, do you know in America, 500 men died last year of breast cancer?
Yes.
And they were like, wow. I said, yeah. And it is deadlier in men than women because the men don't know that they have cancer.
Mm-hmm.
So I will be looking forward to working more with you and partnering and seeing how we can go.
Yes. I look forward to that too.
Absolutely.
Talking about, just I would like to ask you one question. What is one piece of advice that you would give to a younger 18-year old yourself? What would you tell yourself?
That's a beautiful question. You're the first one who asked me, like, if I'm to look at myself 18 years ago or when I was age 18,
Yes.
I would advise myself that I would advise myself to work harder than I worked or as I work now.
Wow.
That you should work harder so you achieve more. Never relent. You see, like you said, people do, you tell them to do it 100 times. Don't give up.
Yes.
When you start to feel the pain, that is when you should start to
Yeah.
gain more. momentum. So that's my greatest advice to everybody. Work harder and remember, work smarter.
Right. Yes. Sometimes you just forget to work smart.
Work smart.
Yeah.
Somebody who works smarter, if you and somebody are working hard and you also work smart with it, you would get the person. How am I talking? Two of you are running and you say, hey, okay, we're both running. Okay, I'm going to take a car and drive faster. You so you've applied your smartness to it, but the person is just walking with the legs. But you have even taken a plane and got it to where you're going fast. So you applied your smartness to it too. All the time,
Yes.
don't think of cutting corners. That's another advice. It doesn't pay all the times, but try to work smart. There's a difference between being smart and cutting corners. You can work smart and achieve your goal.
Yeah.
That is my advice I will give. I will advise myself or someone of 18 right now, work smart. Do you know that there's a lady of 25 who has really achieved a lot because she studied here in the US, but she's from Africa. She studied in the US and she gained a good number of impressions and impact in the society that people who are even 10 years older than her haven't achieved what she has done.
Right.
So she has really worked smart.
Yeah.
That's what I mean.
Mm-hmm.
18-year-old person, if he or she works smart, the person can achieve what a 48-year-old person didn't achieve.
Right.
So work smart and work hard. Thanks. That's good.
Definitely. Have you had a mentor to help you, guide you through this journey?
Yes, I've had multiple mentors. My lecturer was my mentor. Currently, my lecturer, my professor in the university, is my mentor. I've also had mentors in families. I've had mentors, even some I haven't seen in person, but
Right.
I watch them and I see what they do, and I'm like, wow. A good example of somebody who is not even in the medical field was the former Secretary General of the United Nations. His name is Kofi Annan.
Mhm.
He's late now, passed away, but he's somebody whom I admired. The reason is that he came from a poor background or came from a low background from Africa. And the person rose to become the Secretary General of the whole United Nations. When he walks into the hall, everyone stands to give respect, irrespective of their race, their gender. Also, I look at someone like Mahatma Gandhi, who
Right.
lived in Africa,
Mm.
in South Africa, and he looked at the discrimination which was going on
Yes.
between the apartheid. And he came out and says that what there should be no discrimination. He went back to his country and made a revolution. Revolution without fighting war, without gun, without nothing. Peaceful revolution. Another one is this Reverend sister. I believe she was also in India, who said, if you don't want babies, just give them to me. There's
Mother Teresa.
a Mother Teresa. These are my mentors. I've never met them in my life. Maybe I was not even born when they were active. But their works make, and there are many people, prophets. I read religious books too. There are many prophets that have come before. They are my mentors because I see the life they live, golden life. They are upright. They don't lie. They don't cheat people. They smile all the time.
Right.
Bring peace, spread peace, feed people, and you will live in peace. This has been my golden word. Spread peace, live peace, and you will live in peace also. So
Definitely. Wow. Amazing. My mind is blown away. This is one of my favorite sessions that I've had.
I am sincere, and in fact, this is something I've been saying repeatedly in this. I love this. This is one of my passion. What I'm doing with
Right.
you, it's a passion. I would love us to do more. We could do. You can next one. You can look at it. We can collaborate with someone again, and three of us talk, or we could do more in India or here in America. Even bring, and my own suggestion, we can even bring people who are outside medical. They will have a medical story and tell them, talk about a medical history. Maybe example I'll give you. There was a lawyer. She lost her sister from cancer.
Mhm.
So we can talk about how we can bring her on and talk about your cancer story.
Right.
Another person lost from diabetic foot. amputated, another one from breast cancer, another one from stroke,
Right.
where they had to do multiple therapies to get fit.
Yes.
So it's a good idea. We can expand the horizon even beyond medical professionals to even celebrities, even those who are not celebrities, people who have history of stories relating to health, particularly therapy.
Mm-hmm.
We would be able to share more ideas with people, benefit more.
I love it. Let's do it.
Let's do it. I'm serious.
I'm in.
Send a message. I respond immediately. Bring an idea. I also bring ideas. Like as we are doing our interview, as we're talking, I'm bringing
Yeah.
ideas that we can expand. I saw the beautiful job you're doing.
Thank
I've
you.
been watching you, and I saw most of them are health people, health practitioners, people. Yeah, let's expand beyond the health. Let's bring
Yes.
people of other fields, and they have a health story. At least they were born. They've seen somebody being born. They've seen someone fall sick. Let them tell their story about that health condition.
Definitely.
Let's do
Let's
it.
do it. Yes. Where is, can you drop your, where people can reach you out, your email, your
Yes.
contact, however?
Yes. So the website is very, very simple. We have two. I'll give one official and one personal, but you can reach us on. So the website, the first one is https://lho-live.com. So I can also just type it here so everybody sees
Yes.
it. It is lho-live.com. So that is it. I'm typing it here. Dash live.com. So I've sent it. You can reach us there. And also you can reach us on consult@lawforhealth.com. You can send us an email at loveforhealth.com. And you can follow us at Dr. We Love You on all our handles at
Mhm.
Dr. So at Dr. We Love You on Facebook. Yes, Dr. We Love You. Yep. Thanks. So that's it.
That's perfect. Thank you so much for today's session. I love it. It's one of my personal favorites.
We'll
Thank you
do
so
more.
much.
We'll definitely do more. When I also talked with the professor, she was so amazed with the innovative product.
Yes.
We go, my main point I want to talk is we will go even beyond medical professionals.
Yes.
We'll talk to people and we can do it together, interview people, share their health stories, go live, do broadcasts. Addition to this, we can even go live on other social medias.
Definitely.
Facebook, Twitter, YouTube Live, TikTok Live. We could do all this.
Yeah. Maybe let's try Facebook next time. I've never done that. I'm very
Okay.
keen in knowing how it.
Yeah, just send me the same invite, the same thing you did.
Yes.
Send it. We'll go live on Facebook.
Okay. Next time we'll try that.
Yes. I'm also at Dr. We Love You. You can send me the message, send me the invite on Facebook. It's the same thing at Dr. We Love You, Love for Health. So you can look for it. If you don't find it, give me your handle. I would add you. Try and look for me on Facebook. It's at Dr. We Love You, Love for Health. If you don't find it, send me your handle on Facebook. Give me an invite. I can assure you, even if you want us to have this regular, like if you say, okay, we're going to be having it every Wednesdays, I'll create time.
Let's do something. But let's think about it. I would love to pick up a topic and just talk about it with you.
Yes,
Definitely.
we there are oceans of topics to talk about.
Mhm.
Lots of topics
Yes.
in health. Cancer alone, there are multiple kinds of cancer. You have cancer of the eye, cancer of the brain, and I have stories to talk of each. Cancer of the nose, cancer of the mouth, cancer of the ear, cancer of the breast, cancer of the prostate in men,
Right.
cancer of the colon, cancer of the lungs, which is the deadliest cancer, which people don't know.
Mhm.
Rarely cancer of of the heart is rare, but it happens. Then we can talk of hypertension, diabetes, stroke, ischemic heart disease. Even in stroke, we can talk of different kinds: ischemic stroke, transient ischemic attack, hemorrhagic stroke. That's a stroke again. Then we can go into diabetes, diabetic ketoacidosis type 2, type 1, congenital heart disease. Oh, we will not exhaust everything. We will.
We'll do it.
Let's do
100%.
Facebook. Look at your timetable. Send me the invite as you did. Follow me on Facebook, Love for Health. If you don't find it, send me yours. I will follow you. We will. Love for Health. Doctor, we love you. Let's try Facebook Live too. Then we keep going.
Yes, definitely. We keep
The
growing.
secret again to it is you can still continue your regular interview of different people. Then if you have a regular face you are putting on weekly, before a year, when people start seeing what you're doing, people start to accustom, okay, this is a message this group is passing, and they talk of different topics on this. It will even be in addition to your multiple people you're interviewing.
Definitely.
You now have a regular person. You and the person are talking. Like you and I should have a regular day. We keep talking. And when we do it regularly, it might not even be 1 hour. It might be 30 minutes, it might be 20 minutes regularly. After 1 year, people get used to it. Oh, and they learn a lot from it. I'm ready. I'm down with it. Just bring up something. Facebook, I'm ready. Twitter, TikTok, Instagram, YouTube Live. There is YouTube Live too. Good go.
Let's do it.
Let's do it. I'm ready. 100%.
I have a few ideas already brainstorming my mind. I will take time to put it down in good format, and I will forward them to you.
Forward it to me. I'll respond immediately. Yeah. Forward it to me. I'll respond, and we share more ideas and move forward.
Thank you so much for taking and just speaking with me today. Talking about health was amazing. When I got a chance to talk with you, so thank you so much.
Thank you very much too. Have a good one.
You as well. Bye-bye. Good night.
Good night.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.